all children in a population where millions are drinking uncontrolled amounts of water fluoridated at between 0.6 and 1.2 parts per million. Now, you can't assume that in this study of a few hundred Chinese kids that you would have covered the complete range of sensitivity in the kids in Toronto. And you've also got to bear in mind that you've got no way of controlling how much water these kids drink. And I'll just nail this one home if I may. A child drinking 2 litres of water at 1 part per million would get a higher dose than a child drinking 1 litre of water at 1.9 parts per million. Do you understand what I say about there not being adequate margin of safety? Okay, so you can say this study is right. Jan is wrong. The 1.9, that's okay, that's fine. But if you can't do that, then you've got to say, this is ridiculous. Why on earth would you be struggling to save 6/10 of a child's surface, at the same time you may be lowering his IQ, and a few other things with behavior. Fluoride in the endocrine system. Again, National Research Council, several lines of information indicate the effect of fluoride exposure on thyroid function. In fact, European doctors and Argentinian doctors between 30s and 50s use sodium chloride tablets to reduce the thyroid activity of patients with overactive thyroid gland. And the doses that they were using were pretty low. Galactin Joyer, 2.3 to 4.5 milligrams per day, and some people living in fluoridated communities are going to exceed those doses. Bajinsky in the Ukraine found that at 2.3 parts per million of fluoride in the water was a risk factor of more rapid development of thyroid pathology. These were normal people. All these studies are being ignored, by the way, by Canadian health authorities, and no attempt is being made to reproduce them in Canada. Subclinical hypothyroidism is associated with increased cholesterol concentrations, increased incidence of depression, diminished response to standard psychiatric treatment, cognitive dysfunction, and in pregnant women, decreased IQ of their offspring. I think if you look around in modern society, we have a few of these things going on, but nobody in Canada, nobody in Health Canada, nobody in Canadian universities is attempting to see if there's any kind of relationship with these symptoms or thyroid hormone levels and whether or not people are living in fluoridated or non-fluoridated communities. If you don't look, you don't find. And what they do is they assume that the absence of study is the same as absence of harm, which is sheer self-fulfilling nonsense. If fluoride lowers thyroid function, it could explain the delayed eruption of the primary teeth, malocclusion of teeth, lowered IQ in children, and an increase in hypothyroidism among the US population, plus the accompanying symptoms: obesity, lethargy, tiredness, not relieved by sleep. And in fact, those people that complain of being sensitive to fluoride, their symptoms overlap with people with hypothyroidism. The pineal gland. The pineal gland is located between the 2 hemispheres of the brain. It's not protected by the blood-brain barrier. Its function is to produce a very important hormone called melatonin. Melatonin behaves like a biological clock. It regulates the onset of puberty, aging, and a few other processes, including sleep patterns. Jennifer Luke confirmed that fluoride accumulates in the human pineal gland. Now, she predicted this because she said, look, this little gland lays down crystals of calcium hydroxyapatite. This is the same mineral in the teeth and the bones which attracts fluoride like a magnet. And secondly, the pineal gland has the greatest flow of blood per volume after the kidney. Huge amount of blood for its small size goes through this thing, and thirdly, it's not protected by the blood-brain barrier. So she said, I think it will accumulate fluoride. She got 10 corpses in London. She had the pineal gland analyzed, and the crystals had on average, 9,000 parts per million of fluoride. This is lifetime accumulation. These are elderly people. And secondly, the highest is 21,000 parts per million. You are getting levels now higher than somebody with severe, crippling skeletal fluorosis. Huge accumulation in the pineal gland. And what she also did, for part of her PhD thesis, was to show that when the animals were dosed with fluoride, and she fed them with a teat of pet, little drops of fluoridated water, and to mimic what she was the first person to mimic what it would mean to bottle feed a baby. She was probing that area, and she found that these animals had lower melatonin production, and they reached puberty earlier, this stage. Now, one of the things that she did, she searched the literature, and lo and behold, she found that one of these first studies that were done in the United States, one of these first trials in Kingston, Newburgh, in New York, was published in 1956. They found on average that the young girls in the fluoridated community were reaching puberty, menage, 5 months earlier than the girls in the non-fluoridated community. Didn't think it was significant at the time, but interesting, isn't it? Interesting. And of course the authors of the study said, no effects were found. Fluoride and bone. Also from the Newburgh Kingston study, they found that the children in the fluoridated community had about twice the percentage of cortical bone defects compared to the non-fluoridated communities, 13.5 to 7.5%. Statistically significant. Now, why is that important? The cortical bone is the outside layer of the bone, and that's the layer which protects the bone from fractures. So immediately, this should have sent off warning bells. Are young children are they having an increased fracture rate because of being exposed to fluoride in their development years? Well, it took many years later, 2001, where a study was done in Mexico by Alarson Herrera and co-workers. And admittedly, this was in a high fluoride area, 1.5 to 5.5 parts per million. But they did something which we should be seeing being done in thousands of studies. And that is using this non-invasive biomarker of fluoride exposure, namely the severity of dental fluorosis, tells you how much fluoride the kid was exposed to before their permanent teeth had erupted. So you can say, these kids were most exposed to fluoride, these kids were next exposed, these kids were that, and that, and that. Beautiful! It's not often in epidemiology you have such a simple, non-invasive way of gauging exposure to a chemical. But they had it. And guess what they found? They found as the severity of dental fluorosis went up, so did the incidence of bone fractures reported in the local clinics. And the relationship was incredibly striking. It was almost linear. You go double the prevalence of bone fractures in children, going from no dental fluorosis to very mild, doubles again going from very mild to mild, doubles again going from very mild to moderate. All the promoters have done in fluoridated communities is to try to attack the methodology here. What they haven't done is to reproduce this study, or attempt to reproduce this study. Arthritis. The first symptoms of fluoride poisoning of the bone are identical to arthritis. Stiffness, aching joints, and pain in the bones. 100% of disease arthritis affects 68 million Americans. No fluoridated country is collecting fluoride bone levels in a systematic fashion to check the possible connection with arthritis or other bone problems. Like everything else, we're flying blind. Now, this is my opinion, based upon a weight of evidence of animal studies where they found out what levels of fluoride in the bone weakens bones, clinical trials in which they've deliberately given patients high doses of fluoride in an attempt to harden the bone, increase the bone mineral density. to offset the effects of osteoporosis, which is the loss of bone mineral density. And what they found, unfortunately, is it worked. It did harden the bones, but it made the bones more brittle. And instead of reducing hip fractures, this practice actually increased hip fractures in these people. Together with quite a large number of epidemiological studies which are mixed, I think it's highly likely that lifelong exposure to fluoridated water will increase hip fractures in the elderly. Only time will tell. The Finnish study found an increase in hip fractures above 1.5 parts per million. In a study from China, hip fractures doubled above 1.5 parts per million and tripled at 4.3 parts per million. Here are the results. 6 villages, less than 1 part per million. 1.5 parts per million, odds ratio, hip fractures doubled. Between 2.6 and 3.6, it actually had a slight decrease. Village above 4.3, it tripled. This was statistically significant. And some people are only saying, well, you have to get to 4.3 parts per million before you risk increasing hip fracture. And I say, balderdash. These points here may not be statistically significant, but they obviously look like a trend going on here. And we go into that in the book. It's a trend. As far as the National Research Council, they all agree that under certain conditions, fluoride can weaken bone and increase the risk of fractures. This is the bone that we're most concerned about. The hip, this bone in the crest. That's the one that breaks in the elderly, and it's usually life-threatening and certainly eliminates independence of life for elderly people for quite a time. Osteosarcoma. If we go back to that Newberg-Kingston study, the authors say, they did x-rays of all the kids, and they got this cortical bone defects. The guy that took the x-rays, a specialist, in 1955, his name is Cathy, said the gender, anatomical, and age distribution of these cortical effects looks like the same distribution for osteosarcoma. That was the first warning signal from the first study in 1955. It looks like the same distribution as osteosarcoma, a bone cancer, which is frequently fatal in young men. So it was, the statement was, the distribution, anatomical distribution, in the long bones. Number 2, the gender, in males, not females. And thirdly, the age, young males. And this prompted the National Academy of Sciences in 1977 to say, there is no evidence that cortical bone defects lead to cancer. However, it would be a good idea to examine the osteosarcoma rates in fluoridated communities for young men under 30. That's what they said in 1977. Okay, let's run the clock forward. In 2001, we've got to look at the science. Dr. Elise Bassett successfully defended her PhD thesis at the Harvard Dental School. She found in a matched case control study, a very robust study, that if young boys were exposed to fluoridated water in their 6th, 7th, or 8th years, they had a 5 to 7-fold increased risk of developing osteosarcoma by the age of 20. Compared to non-exposed boys. She was the first person that had looked at this issue in terms of when the kids were exposed. Everybody else looked at the total exposure over to the age of 20 and found no effect. In most cases, some cases, they found an effect. But she found this, what is being described as a window of vulnerability, which coincides with the mid-bone spurt, when the bone is rapidly turning over as the young boy is growing fast. Now to politics. That's the science, okay? Now to politics. Her thesis advisor, Professor Chester Douglas, 3 times concealed her findings between 2001 and 2005. He concealed it from his peers. He gave a presentation to the British Fluoridation Society in England in 2002. He says, my study shows no relationship between fluoridation and osteosarcoma. And then he sent a written report to the NRC panel, said, my studies show no relationship between fluoridation and osteosarcoma.